Hi, welcome back to my channel and welcome back to Wonder Snatch. Today is another installment in my Dermatology and Drag series, and today I'm going to be talking about Gender Affirming Dermatology. Now, trans people really need care from all over the place, okay? From the gynecologist, from urology, from plastic surgeons to psychiatrists, but dermatologists play a part as well, okay, to help them on their journey. Alright, so today I'm going to talk all about that and do a nice pink and blue eye look, okay? I'm going to try something really 80s and neon and everything. Alright, and if that's something you see, don't forget to give me a big thumbs up and subscribe to my channel. It would really help me out if you subscribe to my channel and help me reach, let's see, 10,000 by the end of the year. Okay, let's get started. Alright, so let's get started. I'm just going to pop my wig cap on first, and I'm going to work my way downwards from my face, okay? I've been kind of liking that a little bit more, so just do the forehead and the eyes first. You know, just work my way down. Okay, so gender affirming dermatology, or basically dermatology in a transgender patient. Transgender people are more likely to have mental health disorders, okay, such as depression, anxiety, adjustment disorders, and they really need to be helped along their journey. And sometimes having bad skin or having dermatology issues adds on to all this. And so it's very important that we all really try to help to, be empathetic and take into consideration the patient's journey when treating their skin disorders. Okay, gonna use my Instant Age Rewind. And talking about trans people, of course, you have your trans masculine, okay, and your trans feminine, okay. So those that are assigned male at birth and transitioning to female, or those assigned female at birth transitioning to male. Of course, it's everything in the spectrum in between. But for the cases of medicine and dermatology, unfortunately, right now everything's a little bit binary, okay. So definitely consider if someone is non-binary, but you know, sometimes the patient's actual sex actually does make a difference, okay, because of the main baseline hormones and whether the patient can get pregnant or not, okay, or whether the patient's planning to get pregnant, because that really takes into consideration what kind of medications and what kind of treatments you give the patient. Can afford to be a little bit more full coverage, so we're just using a bit of soft beige. Trying my shade stick in Abidjan. Forgot to prime the rest of my face. I'm going to try this new Benefit Professional primer. Okay, and using my white, just gonna start off this nose contour and also start off my brow. So I might as well just put my face tips in first. Okay, so starting off with trans masculine patients, okay, trans men, for example, like Gottmik. The main issues that come across with their transition would be the issues with androgen therapy, okay, because they have to take testosterone, exogenous testosterone. This can sometimes give them stuff like acne and male pattern baldness. And of course the effects of secondary hirsutism, like the growth of the beard and growth of mustache and hair all over the place. That's probably a desired effect, okay, for them. But you know, they might get hairs also elsewhere which they don't really want to get hairs, like their cheeks and their temples and stuff like that, if they're using certain kinds of hair growth treatments. Okay, gonna use my KVD foundation to draw my brows. Thinner brows today. Let me blend this out. That will get blended out later. Okay, so I'm just going to clean it up with my Clown White Light. Okay, so for trans men, when they do present with acne from their testosterone therapy, there's some certain things you have to take in consideration. Okay, most of the treatments will be the same. Okay, so stuff like, you know, washes, salicylic acid washes, topical benzoyl peroxide, antibiotics, or topical retinoids. But you know, taking steroids also sometimes causes this thing called steroid acne, which is a little bit different from your regular acne, okay? This one has less comedones, okay? Remember my acne video, okay? And also, it's mainly can be on the chest and the back. And you know, in trans men, this is an area that they don't want to draw attention to, okay? So this can actually add to gender dysphoria if they have a lot of acne on the chest and the back. And sometimes this leads to scarring as well, such as keloids and everything. And that can add to the, you know, distress when they get acne on this area. So sometimes you have to treat them with stuff like Accutane, okay, or isotretinoin, okay? And it's very important when you're giving them Accutane that they're not planning to get pregnant. And if they do still have their uterus and ovaries and can still get pregnant, they have to be on contraception as well. Because when you're on Accutane, you cannot get pregnant because it causes defects in the baby. Okay, so it's very important to know what stage of the transgender journey a trans man is on when you prescribe stuff like Accutane. And another thing about taking Accutane when you're a trans man is that you should not be doing elective surgeries while you're on Accutane because the wound healing is not as good. Okay, so for example, top surgery and stuff like that should not be done while on Accutane. You should wait at least a few months after you stop the medication before you go for top surgery. Okay, I'm going to use my Gerard Cosmetics Clean Canvas to prime the eyes. Okay, and to celebrate more trans people using Nikki Tutorial's palette, okay, I'm going to try to use the pink and the blues to try to give myself a very graphic kind of an 80s eye. Okay, first I'm going to map out a big crease with Blend and Snap. Okay, my pencil brush. Another issue that trans men face, okay, when they're on testosterone is male pattern baldness. Male pattern baldness happens in cisgender men, okay, mainly have bitemporal recession, okay, the M-shaped hairline, and thinning over the vertex. Okay, and this usually happens to men in their 30s, 40s, and 50s, okay, but in trans men who are in high doses of testosterone, sometimes can get it a lot earlier. So, okay, for example, when they start transitioning in their teens, and this can be, well, sometimes it can be desired, okay, so they look more like a man, but a lot of the times people want to keep their hair as well, so they do need treatment for that sometimes. Just blending the top up. Okay, so now I have a very faint pink crease. I'm going to deepen that up a little bit with Slasher. Just the underside of the crease. Okay, so for trans men who have male pattern baldness, you can treat them the same way as you treat a cisgender person. Okay, so for example, topical minoxidil or Rogaine or Growell. Okay, and you can give them finasteride as well. Finasteride in cisgendered people are usually reserved for men or women who are postmenopausal who are not having children anymore. So it's also very important to know whether your trans man is planning to get pregnant anytime soon, okay, because they cannot be pregnant while taking finasteride or Propecia. Okay, here you don't want to be treating them like cisgendered women because you don't want to give them stuff like spironolactone, which is basically an anti-androgen, okay? Which can actually interfere with their T therapy. Okay, finasteride itself blocks the conversion of testosterone to this other hormone called dihydrotestosterone. Okay, and that usually happens just in the scalp. Okay, it does not reduce the level of T in the bloodstream of a trans man. Okay, but we don't know whether it causes any impairment of the development of sexual characteristics like, you know, facial hair and stuff like that, okay? Probably a little bit, but, you know, use with caution, or if not, just use minoxidil. Okay, just gonna blend that purple out. Okay, I am cheating a little bit. I'm going into my new Sample Beauty Blooming Lovely palette and using this neon pink here to blend those in between. Okay, this helps marry the purple to that pastel pink. Oh. Okay. This is a very light pink floating crease. Okay, and then going back with Blend and Snap. Just going to blend it out a little bit more. Alright, and then going into my P. Louise Rumor Zero, I'm going to cut that crease. Okay, just cutting my crease like that. I'm going to do that on the other side. I'll be right back. Okay, so I've deepened up my brows a little bit, and also went to plot twist all over the lids, okay, to give me this baby blue. I'm going to go in and draw my liner now. Okay, I'm going to use Amsterdam to smoke this part out. Okay, so going over the black with the blue, give it a little bit more of a blue tone. Okay, so next we move on to the trans feminine patients, okay? Assigned male at birth, but transitioning to female. Okay, they have a bunch of other problems. Okay, one of the main things is, of course, excess hair. Okay, so if they were assigned male at birth, they would have facial hair, hair on the body and everything, and a lot of them come for laser hair removal, okay, or other forms of hair removal. We have like depilatory creams that you can use on the face, electrolysis, or even like laser hair removal, which is probably the best, okay? But laser hair removal does work better if the hairs are darker, okay? So for fine hairs like blonde hairs and red hair, sometimes don't come off very well with laser hair removal, and you might need stuff like Vaniqua or Veet and stuff like that. And removing hairs by laser sometimes does cause a little bit of folliculitis, okay? A little bit of folliculitis over the arms and the chest and everything, and these all can be treated with creams and antibiotics and stuff. So now I'm just going to go in the rest of my face. My soft beige. Okay. Bring it up the nose. Concealer. Use the concealer to cut that up a little bit there. Okay. And then go in with a little bit of white. This pointed bit works very well for that. So for trans women, they will be taking female hormones, okay? So it's stuff like your estrogen and your progesterone. And estrogen actually famously causes pigmentation problems as well, okay? So pregnant women, when they're pregnant, they get these things called melasma or chloasma, which are these blotchy brown spots on the cheeks, okay? Where the sun hits. So this can be quite unsightly, and they might need very full coverage foundations to cover this, okay? There are some depigmentation creams containing stuff like tretinoin and hydroquinone that might help, but sometimes they might need laser treatments as well, okay? Or sometimes what we give them are tranexamic acid, which is basically something that's given for people with heavy periods, okay? And this actually helps a little bit with the pigmentation as well. Chemical peel sometimes helps, and stuff like niacinamide and azelaic acid sometimes might help with the pigmentation, but that's really difficult kind of pigmentation to treat. And the best treatment is actually sun protection. Okay, just stay out of the sun completely if you are going to be on long-term estrogen therapy. Okay, using my same Abidjan for my contour. Okay, a lot of trans women also come for feminization, facial feminization, okay? Mainly the plastic surgeons will help to do that, okay, with reshaping the face. But dermatologists can also help facial feminization with stuff like fillers, Botox, and stuff like that, okay? Simple stuff. And you know, of course, makeup does wonders. Look how feminine my face is now. Alright, I'm just gonna powder all that really quickly. I'll be right back. Alright, I've gone and contoured my face and snatched my nose. I'm gonna go in the neon petal. Okay, I'm gonna bring it out and down a little bit. Okay, I'm gonna open up this V. Okay, and now blend and snap to blend that out. Okay, and using blend and snap as a blush, just to fill in that area. Okay, and going in with slasher right on that eye. I'm going to do some sort of a graphic thing here. Okay, I'm trying to go for a very 80s, almost like a gem and a holograms kind of a look, I think. Okay, so some extra space there. So, okay, other things that transgender people need to be treated for are, you know, complications from other forms of therapy, okay? So for example, surgeries, all the surgeries can have a risk of keloid scarring, okay? And this needs sometimes injections of steroids or even very careful wound care, which a dermatologist can also help. Okay, now I'm going to repeat the blue on this side. I'm going to do a little bit of a blue triangle going out. Okay, and so keloids can happen from just normal surgeries, but you know, in the past, a lot of transgender people actually don't trust a lot of mainstream or government hospitals, okay, and they get a lot of back alley surgeries and stuff like that. A lot of times things are botched, okay, so for example, fillers that migrate or silicone implants that explode, okay, so we have to work together with the plastic surgeons and with other disciplines to work on all these complications sometimes. Okay, I have come across transgender folk who, you know, don't dare to go to get hormones from the urologist or an endocrinologist and get them off on the internet instead. Okay, and that actually can be quite dangerous because, you know, they're really taking a gamble on what they're actually getting and the dosing might not be correct. Okay, deepen it with some oxygen. Okay, that's the idea. So another color there. Okay, now going into my Super Beauty, I'm going to go in with a whole bunch of pink and blue liners to sharpen this up. Okay, Super Beauty, this is the UV Taffy's palette. Okay, using this blue, I'm going to go underneath that crease. Okay, can you see that? You can barely see that. Okay, All right, I'm just gonna finish all these little lines up off camera and I'll be right back. Okay, so I've got this pink and blue stuff going on there. Looks a little bit 80s. Okay, I'm gonna go in with my House Labs gel pencil eyeliner, pink one for the waterline. As that continues onto the pink there. Okay, and I also popped in these crystal TDD lenses that Rock'em Sakura recommended on the channel. Okay, lips. Let's try a very, very light lip today. Just lining my lip first with this fuchsia lip pencil. Trans people, as I mentioned, do really need multidisciplinary care, okay, and dermatologists can really help. Okay, unfortunately, in most places in the world, and in Singapore especially, transgender people don't like to come to see doctors in the government hospitals or in places where, you know, they might feel a bit judged, okay? I'm using this Maybelline really, really light color called Dreamer in 10. Okay, it's almost like a lilac pink. And go there in the middle. Blend it into the liner. It's almost like a lilac. It goes really well with the pink and blue theme. Okay. So I do have a couple of stories actually. I think I told this on this channel before, but I have come across a trans man in a clinic who unfortunately still had not had his name changed on his identification certificate. So of course, before they even came in the room, I had thought that it was a female because of the name, and they hadn't changed their sex legally either. Okay, so it was really confusing for me because they were very hedgy about it, and you know, I think we could, me and the senior doctor at the time, could probably have handled the situation a lot better. A confusion didn't make the patient feel at ease, okay? And unfortunately, they felt that they had needed to keep that part of themselves from us, okay? When coming in, basically it was coming in for acne, okay? And counseling on acne and everything. It was a very difficult consultation, okay? But I think in the end, we managed to get through to him, but unfortunately, he never came back because I think he felt so uncomfortable with the entire consultation. So, you know, it's something that we're all learning, and I think we all really need to have empathy for each other when we're trying to figure out these things, and especially the patients themselves. Recently, I had a transgender female come in for hair loss as well. Okay, and of course, like many transgender people, they are very, very well-versed. Well, kind of well-versed in all the drugs and everything because they do all their own research, okay? Because they're so underserved by the medical community that they do their own research and they actually come with a lot of knowledge. Unfortunately, a lot of this knowledge is also garnered from stuff like forums, Reddit pages, chat groups and stuff like that. So a lot of it is very inaccurate. It's very hard to try to correct them or try to give them your opinion because they think they have learned all this from their community and they feel like we're not addressing what they're actually feeling and trying to dispel some of the myths and misinformation and miseducation about drugs and basic physiology is actually sometimes what we need to take on as well. Alright, so I think that lip's pretty much done. I'm going to add a few finishing touches and a lash, and I'll be back with a finished look and a wrap up. Alright? Okay, see you in a bit. Alright, and this is the finished look. A little bit Britney Spears, I think, with my Canadian denim outfit here. Okay, and everything in pink and blue. I even have little pink ends to my blonde hair here. Alright, and that's my video on gender affirming dermatology. I think we have a long way to go, okay, to serve our transgender population well here in Singapore and everywhere else in the world as well. So if you're transgender and you want some advice or treatment, okay, for your skin problems or something, why don't you hit me up or leave a comment down below or hit me up on Instagram, alright? I'll see what I can do for you, okay? And if you like this video, don't forget to give me a big thumbs up and subscribe to my channel and ring that bell for post notifications. Alright, I'm off to film a TikTok and I'll see you next time. Bye! Life-size Barbie. pink and blue. This is more early 90s, I think. Alright, check out my other videos. Okay, my last Dermatology in Drag series was about sunscreens and skin cancer, and I did a beauty room tour here. Okay, check it out. Bye.